All right. Good morning, everyone, and welcome to our Food for Thought speaker series. Today, we're honored to have Professor Rumala Sen, who's going to be discussing the role of bureaucracy in successful coronavirus strategy, the case of Kerala. And now, before we get started, instructions. If you have any questions, please hold them, and if you can put them in the chat, or you can raise your hand under the participants tab, and we can call on you to ask questions directly. And please keep yourself muted unless you're asking a question. And thank you everyone for joining. I'll hand it off to Bill.
Well, good afternoon now to everyone. We're so pleased to have you here as we continue our series from the beginning of the pandemic till hopefully the end and thereafter. And we're very honored to have Professor Sen with us today. She teaches in one of our core courses here at SEPA, the Politics of Policymaking, one of the most important courses for the what I call the daytime students. She's also affiliated with the Saltzman Institute. She's been a postdoc in the political science department. She's has a new book, which is forthcoming from Oxford University Press, looking at Maoist rebels in India. And she's done extensive field work in India about conflict. She's featured in the media. She got her PhD in comparative politics from Cornell. She also has 2 master's degrees. She's an exceptional young scholar and a great teacher. And we're so happy to have her as part of our family here at SEPA. So I want to save as much of the time as possible for her. By the way, her paper on representative bureaucracy and government responsiveness, which is something that I wrote about way back when I was at a similar point in my career about the US. She writes about it in what she characterizes as a small state in India. So to give you a conception of what small in terms of population and India is, if that state were a US state, it'd be second only to California. And I would suspect by the next census, it'll be bigger than California. So 38 some odd million people is by most accounts, not so small. So if things are relevant there, it's bigger. I think as she points out in her paper, it's bigger than Canada. So this is a very big place and any findings from it are significant globally. So Professor, thank you so much for joining us. We're so pleased and proud to have you, and I'll turn it over to you.
Thank you so much for that warm welcome and for that very kind introduction. So the audience here, I want to start by saying that this is actually my new project. So my book is now in press and I'm done with what I was working on. And I have always worked mostly in India, Nepal, Bangladesh, mostly in South Asia. And in addition to quantitative analysis, all of my work has always relied on extensive field work. So this is a new project and I thought I will share it with you guys, and any feedback, any comments that you might have will be greatly appreciated. So I'm going to talk a little bit about Kerala, and I think Bill gave a pretty good perspective on that. Yes, almost bigger than Canada. That's how big Kerala is in terms of population, but it's one of the smaller states in India, in the southwestern part of India. And Kerala has actually extensively been written upon. It's been a topic in political science, in economics, and public policy literature for the last 50 years. Because among all Indian states, Kerala is kind of an exception in many ways, and I'll talk about it. Why is Kerala such an exception? And one of the most important reasons is that Kerala has consistently been a social democratic state in India. So it's ruled by a left front government. And although the main party in this left front is a Communist Party of India, Marxist, you can call it, in terms of its policies, it's more social democratic. And so Kerala has faced a lot of resource constraint from New Delhi historically because of this communist bent and because of this political disagreement between the center and the state. So India is a federal country too. Federalism is strong there, but Kerala has often complained how it has received kind of a stepdaughterly treatment from the center. So has not received as many resources as it has wanted historically. So there is this conflict always there. But the word Kerala model is really popular in social science for over the last 50, 60 years. The reason I wanted to look into Kerala in the context of coronavirus is that Kerala did exceptionally well. And when I say exceptionally well, what I mean is Kerala actually reported India's first coronavirus case in January. This was a medical student who was returning from China. And in 5 months or 4 months, Kerala, by May, it was noted that Kerala had 524 cases of COVID-19 and only 4 deaths and no community transmission. Now, this was highlighted in the international media extensively, and I'm going to come to that. And one of the reasons that the explanations that came up is that Kerala has historically been really good at fighting disasters. The disaster management division of the government has been dealing with a lot of different communicable disease starting back in 2001. And this slide that you see here kind of gives you a timeline of what are the different things, communicable diseases that the government has been dealing with. And the latest of it is Nipah virus in 2018, which Kerala also managed really well and has been studied extensively. And Nipah virus was much more, higher fatality rate than COVID. So that is one of the explanations that has come up in terms of Kerala's experience of dealing with this kind of diseases. And again, to give you a little bit of context for Kerala, not only does the state have a very high density of population, which is 860 people per square kilometer, its GDP per capita is also quite low. So it's only $3,200 compared to United States, which is 15 times greater than Kerala, right? And in spite of that, the reason Kerala became the focus as a successful model of dealing with this crisis is because around the same time, between January and May, where Kerala reported only 4 deaths, United Kingdom reported 40,000 and United States reported 82,000 deaths with a lot of community transmission. That's the other part. Kerala virtually controlled all kind of community transmission during this time period. Right, in spite of low GDP and the very high density of population, that is considered a remarkable feat. And so the study, it came up all over in the international media. New York Times did a story, the Washington Post did a story, the Guardian did a story, and the Chief Minister of Kerala and the Health Minister of Kerala, particularly K.K. Sailaja, the picture of the woman that you see here, she became very famous and became known as, the coronavirus slayer. And so there were a lot of interviews that they did in the international media as well, right? But before I have to pause and tell you the other side, the darker side of this rosy story. Kerala was actually doing very well from January to May. But if you look at the second phase of this crisis, starting end of June to September, Kerala's success story has actually not been as bright in the sense that in September, Kerala had one of its worst months. Yesterday, actually, Kerala had the highest deaths over the last 9 months that the state has been fighting the disease. So October 7th, Kerala recorded 900 deaths, right? So there is a variation that I want to highlight between phase 1, which was really successful in terms of controlling community transmission of the disease, and phase 2, where the community transmission of the disease was really, really high. Right, and so now Kerala is right now, and looking at the numbers, the 9th highest state in India in terms of the number of cases. And so the death toll right now in India is about 100,000. And there are over 6 million confirmed cases, and Kerala is 9th highest among all the Indian states. So it's not doing as well in the second phase. Right, so methodologically speaking, it gives us a chance to compare phase 1 and phase 2 as well. So in addition to, I'm a comparativist, I do comparative political science. So for us, we compare Kerala to other states, we compare Kerala to other states in other countries, and then this gives us an opportunity to compare phase 1 of Kerala and phase 2 of Kerala and see what exactly was different between these two phases, right? So another reason I want to look into Kerala for this new project is that there is a wealth of literature on the Kerala model that traces the history of Kerala back to the pre-colonial times. So one of the explanations for Kerala doing so well compared to other Indian states, compared to other states in other developing countries of the world which started similarly, is there was a history of reform movements in the state, particularly reforming caste inequality. So the history of the state is very important. There were a lot of popular mass-based movements, even in the pre-colonial days, even in the pre-independence days during the colonial era, that focused on fighting caste inequality in the state. And in addition to that, when Kerala became independent, the first government, when India became independent, in 1947, Kerala was the earliest to form a communist-led government. So there was a lot of emphasis on redistribution, right? Kerala also, in terms of output, has the highest female literacy rate in India. It has very low infant mortality rate, high life expectancy. All these factors that are taken as important components of well-being, of human development. So those indicators, it might not be so high in terms of GDP, in terms of income, those measures, but in terms, if you look at the indicators that measures human well-being and human development, those indicators are really high in Kerala historically. This was high also before India became independence, but it became really, really, much higher than other Indian states over the last 70 years of Indian independence. Now, the argument of Kerala model, on which I think Amartya Sen's idea of public action, there's a lot been written on this. If you Google Kerala model, you'll have like 30,000 hits. Like a lot of people has written on this. But the idea at the heart of the Kerala model is Amartya Sen's idea of public action. So Jean Drèche and Amartya Sen has written on this idea of public action, and I'll talk a little bit about it here to give you a sense of what makes up this public action model in Kerala, where the argument basically is that service provision, which is one of the ways we measure how effective and how responsive government is, how good is it in delivery, in public service delivery, right? And Kerala is very good, not because of physical facilities. So one of the things in political science, in the literature on public service delivery, is like you look at the institutions, you look at the concrete infrastructure. But the public action idea says it's not just about physical facilities. It's also about what kind of citizens you build. It's not just about what kind of institutions you build, but what kind of citizens do you build? And so Kerala has been really successful in creating a very aware and active citizen. So there are a lot of public participation in civic actions, a lot of public participation in protests and in demanding. So the public is not only much more, so the literacy rate in Kerala is higher than all Indian states. It is in 95, more than 95%, and very high female literacy. And so the public is there is evidence, there is documented evidence that the people in Kerala have shown over the last 70 years of Indian independence more collective action than any other Indian state, right? And this happens because there are legal protections available to the citizens. So that's the argument that Amartya Sen and Jadresh makes, that the government, because of its ideological bent for the kind of politics that it believed in, invested in this legal protections for citizen activism. It invested in a robust healthcare, public healthcare, free for all, available to all the citizens, and in literacy. So the kind of process that we think of here when we talk about the Kerala model and the success of the Kerala model is there were policies made by policymakers that encouraged private action of the citizen, and all these private actions together accumulated to what they call public action, which basically demands better policies. And this creates a positive feedback loop into policymaking. And this has been going on and has been amplified over every decade in Kerala. So it's really strong in Kerala. And the emphasis of the government, as I mentioned, was redistributive justice. That was the emphasis of Kerala model during the first, up until the 1990s. It was the emphasis as the policymakers in Kerala have written about it, and even the scholars who have written about the Kerala model have also shown how all these policies were towards redistribution and towards redistributive justice. Right, and there are other components, more like empirical manifestations of this Kerala model. You would think about massive decentralization. And I'm going to talk a little bit more about decentralization here. So India has always had this emphasis across Indian states at the federal level, this emphasis on village level administration, to decentralized administration down to the village level. And they use a Hindi word here that has been used traditionally is panchayat system. So the village level administration has been a focus of constitutional amendment, that 73rd constitutional amendment in 1990s, that the states have to adopt it, particularly for some states in North India that had more centralization of power in the hands of the capital state. But Kerala did the best in decentralization. So there are 941 village governments in Kerala, village level governments. And at this level, it is at this level that Kerala's battle against coronavirus was most successful in phase 1. And it's still, the phase 2 is still an ongoing phase, right? The worst thing started in September, October. So we'll see how the village government now responds in the face of community transmission, right? But there were 941 village level governments that responded to the crisis through massive decentralized tracking and isolation. And if you look at the media coverage of Kerala outside India, this is what receives the most attention: tracking and isolation. In addition to that, you'd hear about this army of volunteers that Kerala has, that no other Indian state. This did not come up overnight. This army of volunteers has been part of the public action model of Kerala's governance over the last 70 years. And there was a seamless coordination between the state governments, the local governments, and the army of volunteers, the citizens that jumped into this crisis to help the government cope with this crisis. And in this, so some examples of this seamless cooperation is the Kerala Community Kitchen Initiative that the media has covered extensively, and I wish I could just go and see it, so I could understand more how this is working, the steps in it. But from what I read, they are delivering essential commodities at the doorsteps of people who are in isolation. In addition to that, they're delivering packaged, freshly cooked food free of cost at the doorsteps of people. And there is this program in Kerala called Kudumba Shri, which basically is a program mostly run by women volunteers from 16 to 65, but not only women, but there are a lot of women here, who are running this Kerala kitchen, community kitchen initiative. And they have done it in all the previous crises. So I have it in the paper the day the chief minister called on these army of volunteers that this is a crisis and we need your help. In one day, there were over 500 community kitchens across Kerala. And by August, there are 1,145 community kitchens running in Kerala. So when the international media was covering news of, migrant workers in other parts of India, because now the migrant workers had lost their jobs and they are coming back with their possessions and their children, carrying them on their back, people dying on the streets, there was misery all around, not a single case in Kerala, because Kerala was equipped with food, with medicine, with water, with clothes for these migrant workers. There were shelters, very inexpensive hotels built overnight in the form of tents to create shelters for these people. So this is massive state capacity, as we call it in political science, right? Or in public policy. The capacity of the state, despite the fact that it's not a very rich state, is very high density of population. This state capacity, where does it come from? So that's the puzzle we are interested in. How did a small, poor state in India manage to mobilize this kind of state capacity in the face of crisis? So this slide I just put in here to give you a sense of the levels of decentralization. It is most formalized in Kerala, right? So 941 different units working together, receiving instructions from the district level administration, from the state level administration, from the federal level administration. So who are the people who are making all these things working seamlessly? And the argument that I want to make here is the bureaucrats. The bureaucrats play a very important role in this kind of mobilization of state capacity in the face of a crisis. So the Kerala model, the literature on Kerala model that I was talking about, that Amartya Sen has written extensively about, and many other political scientists, sociologists, and economists have written about, by the 1990s, the scholars started noticing that the emphasis of the Kerala model is now changing from just redistribution, which was the ideological priority for the left front government that has been ruling the state. And just to, for all of you who are not as familiar with Kerala, I just want to put it out there that there is a left front government, and then there is a united democratic front that is Congress-led. So what happens in Kerala is these two, the left democratic front, or the LDF, and the United Democratic Front, or the UDF. You can think of the UDF as a centrist coalition of forces led by the Congress party, right? So one election, the left front would win. The next election, 5 years later, the UDF would win. The next election again, the LDF would win. So the people of Kerala have been holding their state government accountable pretty consistently. So they alternate between the centrist and the left-leaning government in Kerala. And by 1990s, scholars started noticing that the emphasis in the Kerala model has changed from just redistribution more to these concepts that are very popular in the World Bank literature, right? Participation, accountability, transparency, and government responsiveness. So now, since the late 1990s, scholars have been writing about the responsiveness of the Kerala government to people's need. It's an important factor that explains why their public service delivery is so good. But the focus is always on the elected representatives, right? So the question that I want to raise in the context of this very rich literature on how a responsive government works is, what is the role of bureaucracy? Does the bureaucracy in some way mediate between the strong institutions and the empowered citizens in the public action model of Kerala? Right, and we know that Kerala has always had an interventionist state that had been committed to pro-poor redistributive policies. We know that that Kerala has a very active, mobilized society, well-organized mass organizations, and volunteers. and political parties working together. But what is the role of bureaucracy in this process? And the argument that I want to make is this is a question that is particularly important in the context of a low-income country and in the face of a life-threatening pandemic, right? So what role does bureaucracy make in this particular case? And when we talk about bureaucracy, I think it's inevitable that we talk a little bit about the Weberian idea of bureaucracy, right? That's what we intuitively people tend to think about when we think about bureaucracy, that bureaucracy should be rational and should be bound by rules of impartiality and meritocracy. And the reason that we want the bureaucracy to be insulated from popular opinion is that we know that the elected leaders are already responsive to popular opinion. And by keeping the bureaucracy insulated from the public, particularly in the context of a country like India, which has a very diverse public and very contentious politics as well, you also try to insulate the bureaucracy from patronage, from clientelism, from nepotism, inefficiency, corruption, all those things that we hear in the context of weak institutions, right? So if we have to ask that is true for all Indian states, but is there anything about the bureaucracy in Kerala that makes the state capacity of Kerala so much better than other Indian states in the same country? And then this focus since 1990s on accountability and legitimacy and transparency and government responsiveness, how do we reconcile all this with the bureaucracy that is working in a very diverse democracy? So India has 29 different languages, many different religions. People in different states speak different religions and do not understand different languages, and do not understand each other's language. So the diversity in India is really rich. So in a context like that, how does a bureaucracy that is completely insulated in the Weberian sense, how does the bureaucracy work? How do the people, the idea of public action, of this idea that people, the common faith in collective action for people to come together and demand better policy. How do we understand that in a context of a bureaucracy that is completely insulated in the Weberian sense? So the idea that I want to propose against this idea of Weberian bureaucracy, and I'm not proposing it, is the theory of representative bureaucracy. So the theory of representative bureaucracy is saying exactly the opposite of what Weber thought. And it basically says that, simply put, that bureaucracies must reflect the diversity of the population. And if the bureaucracy is representative, it will provide higher quality of service and will be more responsive for the members, to the needs and demands of the members of the community. Now, there are two kinds of ideas in this theory of representative bureaucracy. One is the idea of passive representation, which basically means that the bureaucracy should reflect the demographically mirror its constituents. So whatever is the composition of the population, the bureaucracy should reflect that. And then there is another idea of active representation, And passive representation just focuses on the composition of bureaucracy, but active representation is not automatically guaranteed with passive representation. Active representation only happens if the bureaucracy exhibits the pursuit of policies that reflects the interests and desires of the people. So simply put, passive representation is if the bureaucracy looks like the population, and active representation is, we look at the outcome. Is the bureaucracy really producing policies that reflect the interest and the desires of the people? Only then passive representation in terms of demographic representation then translates into active representation. And if you were wondering, well, that all sounds very good, but how does it really happen? So the theory there is that, individuals, their experiences are shaped by their identities, by where they come from specific social experiences. And once their identities are influenced by their experiences, we can also expect that these identities would influence their decisions and their values and what they consider valuable, right? For example, in bureaucracy, we often hear this word, this kind of panacea of all ills, efficiency. As long as the policy is efficient, but the question that we need to ask in the context of representative bureaucracy is efficiency for whom? As policymakers, whose efficiency would bureaucrats prioritize? Whose well-being would bureaucrats prioritize? And if there is a value judgment involved there, then representative bureaucracy would say, well, individuals that represent a particular demographic and share their social experiences, their values will influence their decisions on policy issues, right? So sharing of identities between bureaucrats and clients would lead to more positive outcomes for the people, for the client here, right? So that's the idea of representative bureaucracy. But unfortunately, the idea of representative bureaucracy in the literature is very American. This whole literature is based on American experience almost exclusively. Very little has been written on representative bureaucracy in the context of other countries like Canada and United Kingdom, some Scandinavian countries. A recent article came out on South Korea, but nothing on India. So I wanted to mention this because as scholars, as practitioners, we have all heard of the downsides of ethnocentric literature and ethnocentric assumptions, right? So we want to make sure that does this idea of representative bureaucracy really travel well to a case like Kerala, right? So I'll just pause a little bit here and see if there are any clarification questions that I answered, because I'm going to transition specifically to India now. This was more the theory of representative bureaucracy. Is everything clear so far? Any questions? I'm that good. Nobody has any questions for me? Good. Okay, great. I'm going to go to and talk a little bit about India. And I'm assuming here that most of you won't have really, you don't know the details about India, right? So I'm going to spend a little bit time here to give you a little bit of background to understand the, why representative democracy would be relevant in the context of Kerala and what the challenges would be, right? So whenever we talk about representation in bureaucracy in India, it lands us in a soup, because it lands us in a very contentious political debate in India. It's called reservation. It's the debate over affirmative action in public service. That has been going on for a very, very long time. And I'll talk about the various axes in affirmative action, gender, but the most important axis here is caste, right? So the caste system in India, the policy of affirmative action has generally recognized reservation for three groups. The first is the scheduled castes. So I put this picture here, if you see on the slide. In Hinduism, the assumption, the religious assumption about caste is that caste is a division of labor among people, right? But people are born to certain caste, and there is a fourfold hierarchy of caste in India, the highest caste being the Brahmins, who are the priests and the teachers mostly. Then comes the Kshatriyas, who are the warrior class, the warriors and the rulers and the landlords, and so those who have a lot of property and those who can fight. And then there are the Vaishyas, who are the farmers, the tradesmen, the merchants, that's the third class caste in the hierarchy. And the Sudras are the fourth caste. And I put this here just to give you a visual idea of where this idea comes from. Apparently, the Brahmins were created from the brain of God, and the Kshatriyas were created from his arm, and the Vaishyas were created from his legs, and the Shudras were created from his feet. So this is the fourfold classification of caste. But there are a lot of people who are outside this fourfold caste division. And they were historically known as the outcasts or the untouchables. Now, untouchability was legally banned in India, right after India became independent. But we all understand the difference between what happens socially and what is legally not allowed, right? We see that in the context of United States a lot as well, in the context of racial relations. Right now, we are talking about it here a lot. In India too, this is an extremely contentious political subject. And so the Dalits, or the outcasts, or the formerly untouchable population are known as the scheduled castes, and they constitute about 17% of the population. And in the scheme of affirmative action, they receive 15% of jobs are reserved for them. Okay, and then there are scheduled tribes who constitute about 8% of the population. The tribes are actually not considered Hindu, so you don't even see them in the fourfold classification of caste. These are the original inhabitants, the aboriginals. There are many different tribes in different parts of India, and they're concentrated in certain parts of India, mostly in the more remote parts of India, right? And they constitute about 8% of the population and get about 7.5% of reservation of jobs, right? And then there are the backward castes. So the reservation for the backward castes are actually, this came much later. Interestingly enough, they were not called backward castes. They were called backward classes by the first Prime Minister of India, Jawaharlal Nehru, who hoped that pretty soon people in their drive for modernization and industrialization will forget all these primitive categories. So he just called it other backward classes early on, but well, that did not happen. So the OBCs, as they are known in India, they receive 27% of the population. And I just want to highlight here that there is no recent estimation of what percent of India is OBC. The last estimation that we have is the 1931 census data, which says it was about 52%. There are census conducted, but the data is not released by the government for the fear that it will start a political bloodbath, because the reservation for the OBCs is not commensurate to their percentage in the population. Okay, so we still don't know, but it is, by all estimations, it's between 41 to 52% of the population are OBCs. So the OBCs would be the Sudras, the lowest caste in the caste hierarchy that you see in the picture. And so far they have 27% reservation, right? So any question of representative bureaucracy in India would have to go through this, I was going to say nightmare, but this politically explosive debate on reservation and affirmative action in India. Now, let's also talk a little bit about gender-based representation in bureaucracy, because gender is another axis in the literature on representative bureaucracy. And this is the weakest link in the literature. First, the very, very thin literature that we have on gender-based representation in bureaucracy, very thin, would ask questions like, look at the outcome, right? So the assumption is, if gender-based representation is good, we should see some kind of difference in the policy. So one study, for example, asks, well, does female leadership in the police increase gender-based arrests in gender-based violence, so domestic violence or gender-based violence? And they basically showed that, well, there was no statistically significant difference in outcome from increasing representation of women in senior positions. And then there is also the question that, well, does increasing gender representativeness reduce corruption in the organization? Because there is this assumption that women are less prone to corruption than men. And so they look at the outcome and decide that it increased the reporting of sexual harassment and violence if there is more women at the top, but it did not necessarily significantly improve the performance of the organization in terms of corruption, in terms of cases not reported, right? So this is all we have, one or two case studies, not a really rich literature, and again, nothing in the context of India. But if we were to investigate this question in the context of India, what do we know? We know that there has been a women's reservation bill that's trying to reserve 33% of seats in India's parliament and in the state legislative assemblies. And this has been languishing for 25 years, 23 years now. So every time the bill comes up, there is a political confrontation, nobody can agree, and then it just goes back to the next session of the parliament and to the next and to the next, and nothing has really happened. Now, Kerala is considered a basket case, the ideal model of women's empowerment in India, because of very high literacy rate, high representation of women in public service, and in college educated population, women have a significantly larger share. And so Kerala has been the basket case, but let's look at the performance of Kerala. When I looked at the data, out of 905 elected representatives to Kerala state legislature over the last 70 years, only 48 were women. So in the context of coronavirus strategy, for example, the health minister of Kerala is a woman who used to be a public school teacher and has been applauded in international media for her very effective handling of the crisis, right? And so there was a lot of coverage in the media on how a woman is really going to be the solution of coronavirus, with a comparison with New Zealand's prime minister and all that. You know, there's this argument being made, but just one person at the top does not really mean anything, right? But there is this disproportionate focus on that, while the data shows that it's not even 10%. So 48 out of 905 are women over the last 70 something years, right? And so I put up some more data here for you. In the Indian Parliament as a whole, there are only 11.8% women in 2014. Kerala also 11% women in the Indian Administrative Service, which is the elite bureaucracy in India, very selective, very elite, modeled on British bureaucracy from colonial era. It was called Indian Civil Service. Now it is called Indian Administrative Service. And as of 2014, there are only, in spite of being very elite, urban, drawing students from the best universities of the country, only 11% are women. And while India is often, you know, hailed as a successful democracy in a context where all other neighboring countries have failed, India actually does much worse than other countries in South Asia, behind Afghanistan, Bangladesh, Pakistan, and Nepal. So this theoretical link between democracy and representation and empowerment certainly did not work for women's representation in South Asia, right? So that remains an issue in general, not only in bureaucracy. But how do we look at the role of representation when we want to do it, like at a more empirical level? What is bureaucracy? So now I want to talk a little bit about the different levels in Indian bureaucracy and the empirical strategy I have in mind to investigate this question of representation, right? So here again, any feedback that you might have, any literature that you might know, or any other case study that you might know in other countries will be really helpful on how to do this. But let me share my plan with you real quick. So the Indian bureaucracy is composed of both central, which is federal, and provincial civil services, which basically means India has the all India level examination called the Indian Administrative Service Exam, or IAS. And then Kerala Public Service Commission also has its own administrative exam bureaucrats called the Kerala Administrative Service. Now, the Kerala Administrative Service is also modeled on the Indian Administrative Service, several rounds of interview, written exams, and then, you know, there are face-to-face interviews and so on. So it's a highly selective service, right? And one way of going about it, and since Kerala is exceptionally good and India is also pretty good in terms of data, one way of going about it is to just create, you know, get this descriptive data on caste and gender breakdown of the bureaucracy in the state of Kerala, right? And then India has census data, which provides information about the population, the caste, the breakup of the population. And so we can easily compare that, the theoretical aspect of passive representation, right? Does the bureaucracy in Kerala represent the demographic composition of the state, right? And we can do this at the apex level, right, with the Indian civil service, which is the federal civil service level, and then below at the state civil servants, and going all the way down in different departments. So that is something that can be easily done with the given data. Then with the coronavirus, again, Kerala has maintained a very top-class data dashboard that is updated real time. So you can see the district and town level data on the outcomes in both mortality and in relief measures and number of hospital admissions, number of people who are getting cured, all those very disaggregated data at district level and town level as well. So it will not be a problem to get in terms of outcomes, in terms of measuring outcomes of success, this data is also available. And the first thing I want to do is create a database that basically matches the individual characteristics of the bureaucrats with district level and town level outcomes, and see if there is a statistically significant relationship between the two. Now, the literature, again, the very American literature that I have been looking into for representation in bureaucracy, also highlights that it's not just the top bureaucrats. What is more important in the case of a crisis response is to look at the social origins of the frontline case workers, right? Because the frontline caseworkers are the people, really the face of bureaucracy that ordinary people really sees in this kind of crisis, or even in the day-to-day policymaking processes, right? So we have to look into the social origins of the frontline caseworkers and see how that affects. And I think that is where interviews and focus groups and field work, more ethnographic field work, will be more relevant. Right? And then one of the theories that is available in the literature is that it's not just the bureaucracy and the representation in the bureaucracy, it's what kind of agency are we talking about. So I talked about it a little bit in the paper, but this organization, this program called Kudumbashri, which has been a very long nurtured volunteer recruitment program in Kerala, where they recruit volunteers between 16 and 65, and they are activated in case of a crisis. So this is not readily available, and this is something I want to pursue and see, is it true, make a comparison within organization between Kudumbashri workers and some other department in the bureaucrat, to see if the emphasis of a particular department is redistributive, is the emphasis is welfare, then there are more chances that the social origins of the bureaucrats will be more relevant in predicting their values and their attitudes. So again, this is a very new field of literature, but I think there is, because we are talking about multi-level comparisons, this comparison between two different departments in the bureaucracy would be interesting to see in terms of bureaucratic representation. And the other empirical strategy that has been used in political science in other cases is to compare proximate towns. So town level administration, if we focus on town level administration at the micro level, the map that you see here in Kerala shows that some districts did better than other districts. So if I took a district that is light peach, for example, Ernakulam here, that shares border with a red district, Thrissur, for example. So the red ones did really bad, and the peach ones did really good. And I took two towns, one in Ernakulam, one in the red district, and proximate to each other. So they are so close to each other, neighboring towns, that they are all very similar in all other respects except the town administration. So then you cannot say it's public action, you cannot say it's representative government. So the only thing that will be significantly difference between these two towns in a district doing good and a district doing bad will be their administration. And if we are able to find districts, towns like that, which I think we will be able to find, we can compare the role of bureaucracy and see how the towns performing well, was there higher representation than the towns that were not performing so well, right? So that will give us some evidence on representation in bureaucracy. If we could show that, these two towns are two different districts, one of them did really well, and that one had more representative bureaucracy than the other one, then I think that is an important contribution in the literature on representative bureaucracy, on the policy advocacy side also, what does representation in bureaucracy do to policy outcomes, and also on the literature in Kerala, right? And then I talked about this a little bit. The other level of comparison would be between the phase 1 and phase 2 of Kerala, where the phase 1 was marked by political consensus. So there's very contentious politics and democratic politics in Kerala between the left front and the centrist government led by Congress, or the centrist political coalition led by Congress. In the phase 1, there was a political consensus on, okay, let's do lockdown, let's do very stringent rules for masks, let's invest a lot in in public health, there was a lot of consensus and it worked out well. But this consensus started fracturing with the coming in of migrants to Kerala from many countries, particularly in the Middle East. There are a lot of people in Kerala who work in the Middle East, and so remittances from this population is really important for the economy of Kerala, and so they are a very politically visible category. And when they were coming in, there were protests when the government was trying to put in very stringent restrictive measures of testing at the airports, right? And that's where it became political, and the adversarial politics just went on through August and September, and there was a big festival in Kerala in August, and after that community transmission really started picking up. And so one of the theories in the literature on bureaucratic representation is that bureaucracy can only work, no matter how representative it is, if it is supported by some kind of political consensus. So this aspect of the literature Kerala offers a really good case to test that aspect as well. Excuse me. Okay. All right, so I'll just stop here, and I think there are three important aspects that if you have to take away something from this presentation, is what is the role of bureaucratic representation in improving public service delivery? And the coronavirus case, the performance of Kerala, at least in the first phase, is a very interesting case to examine this question. And there is a sizable body of literature that is very recent, still developing, that is mostly in the context of United States. I think it will be interesting to take it to other countries, particularly the largest democracy in the world. We all know, people who are working on South Asia, the joke is that you take any well-developed theory to die its death in India. So it might be that we don't know but there is no literature on this in India. So that is one area that I want to work on. And I think it will also provide really interesting opportunities to investigate these issues of intersectionality, caste, and gender, and particularly with field-based evidence to see what kind of values from these different social identities take precedence when it comes to policy delivery. So I think I will just stop here, and any questions, comments, feedback will be really useful.
Thank you, Professor. It was an insightful presentation, and this research seems really, really interesting. Just if you have questions, you can put it in the chat. Any comments as well, or you could raise your hand. Here we have a
So
question.
sorry I took so much time. I just realized there's one.
It's okay. We have a question in the chat. Will you be looking at religion, Hindu, Islam, Christianity as a factor?
Yes, that is also another interesting thing to look at, because religion has been at the center of debate in Kerala. You know, there's a significant Christian population in Kerala, historically. And then there is also a significant Muslim population in Kerala that has recently been dragged into controversy over political Islam, particularly because of the connection with ISIS. So there's a lot of talk on religion. So yes, that would be another interesting axis to look into. But you know, yeah, I'll just write down that comment and see if what kind of data we have on religion of civil servants and so on. But it's certainly relevant for sure. Let me see who asked this question. Alexis. Thank you, Alexis. That's a very interesting and important point. Yes.
I have a question. So I was really interested in that distinction between passive representation and active representation. And I feel like that's kind of one of the challenges we see in the US, where we assume that someone who looks like us is going to represent our values. But just because they look like us doesn't mean they have the same experiences that we have. And that goes to the point of intersectionality and going beyond just what we see. So my question was more so about Kerala and how does that come about within the bureaucracy? Is it something organic that comes from the ideological bent, the way that the citizens see the political system? Or is that something that you have to, I mean, I feel like that's not, there's no really a distinction, but is there an active ideological project that starts from early on to convince people that this is how it should work?
Right. No, that's a great question. And honestly, I don't have a very good answer to that. And that is my, you know, they always say if you want a really interesting project, you should have a real curiosity. Like that will drive you, that will make you work on this for a really long time. And I'm thinking of this as my second project. As the first one is now done in a book. And that is something I want to figure out. There is no real good answer here, but I'm interested in this because Kerala has always had this, like you mentioned, a very active ideological project also, right? So does that play a role? And this can only be, you know, done in a satisfying way through surveys or, you know, some kind of field work where I get to talk to a representative sample of people and see how people see others. But this is definitely the weakest link also in the literature that we have in the United States, right? And this is also the weakest link in the related literature on substantial representation and descriptive representation in the context of elected representatives as well. Like when we say that you need to have our elected representatives who look more like us, so we know that they care about us, but does that kind of descriptive representation translate into substantial representation? There is not much, you know, empirically rigorous evidence even on that. And so these are more, I think, recent frontiers of research, but this is something that is, I think, the most interesting question that is at the heart of this kind of research. So thank you for that.
Thank you. We have another question in the chat. To piggyback on Jeremy's question, there's an emphasis in education, K through 12, to hire teachers who reflect their classroom students. Is there a parallel between political literature and literature from education in producing outcomes for better or betterment?
No, so that is the thing. There isn't. There is some policy literature on specific areas of policy, right? So that's not very generalizable, as social scientists would say. But in education, yes, I'm familiar with this research in education. There's been evidence that it really works when you have teachers who are representative of the population. But this very important question of representation, which should be central to politics and to policy, right, is not really integrated. So if we could take all these different fields of study and this evidence we have in different areas and kind of relate them or kind of bring them together, then I think it will be very useful in putting this question of representation at the heart of political science and public policy studies, and particularly in bureaucracy, right? We have a little bit on elected representatives, but not on bureaucracy. So yeah, no, that's a very good pointer, Alexis. Thank you again.
All right, I think we're a little over, so if anyone has any last questions, please raise your hand or put it in the chat. If not, Professor, if you'd like to say anything before we go.
No, I just want to say, if you have any questions or comments for me, please feel free to email me. Thank you so much. If you come to think of anything, I'll really appreciate it. This is a really new project at the early stage. So any feedback will be really welcome. And thank you so much for having me today. It's really nice to meet all of you.
Thank you so much, Professor. It's really one of the best presentations we've had. And
thank you.
For taking the
That's
time
very
out
kind
today.
of you, Jeremy.
Of course.
Thank
of course. Alrighty, so we have these every week. So if you want to join us next week or anytime in the future, you're welcome. And have a wonderful day, everyone. Thank you, Professor.
Bye-bye.